My advice for doctors contemplating learning how to do canaloplasty or similar surgeries is you have to have the same attitude that you had learning cataract surgery. This is something that you want part of your practice. You want to be able to offer it to your patients, as it is the best alternative that we have for a non-invasive, non-blood forming glaucoma surgery. That being said, the surgery does take some learning. It has some technical challenges, but they are easy to overcome. And I think the major issue is just attitude and motivation. Once I was convinced that these type of surgeries were something I really wanted to learn, because I thought it was the best thing to offer my patient, that solved the issue. It just makes it much easier once you're motivated and are convinced that this is something you want to offer your patients.
If you're a doctor and you're considering adding canaloplasty to your practice, I got to tell you, it's going to be one of the best things you ever did. I think you need to have the temperament for it, and you got to understand that it takes effort to develop it and learn it, but it's so worth it. And I think really what drives it, what drove me to do it, is patient care and patient outcomes. I had a large need in my practice for safe glaucoma surgery, and if you want to be a physician who can meet the needs of your patients, and you have that need, then this is the way to go. It has just really been a great addition to what I do.
I would give this advice to doctors. I would say, make a list, decide that this is what you want for your patients. You have to really believe in canaloplasty, and I do. I really feel that it's a very safe, viable option for your patients. So go ahead and adequately choose a patient that you think is going to be an easy patient to do, and then dive in. And a lot of times you will have help and someone to assist you early on in terms of knowing the steps and knowing the kit that you need to start and the instruments that you need to use for canaloplasty. So certainly it takes a lot of that apprehension out because you do have support. I would advise a young surgeon who feels that canaloplasty is difficult to challenge himself or herself, because certainly I have, during the course of my career, never shied away from doing anything new if I believed in the procedure. And this is something from a safety standpoint for your patients that can prevent late postoperative infections and is a viable option to get them off drops. You don't have to worry about patient compliance. So it's just a matter of taking those steps to learn the procedure, just like you would with phaco or any other procedure that you use.
The advice I give to doctors who are interested in learning about canaloplasty, just like when they first learned phaco, is that yes, there is a learning curve to it, and initially it's going to take you longer to do this procedure, and but the more you do, the better you're going to get at it. It is very important that you set up a lot of patients to do right away and try to do at least 10 patients or more in a very short period of time, so that you can learn and improve on each step as you do the procedure. And once you do that, I think you'll find that the procedure is quite doable and the results are quite excellent.